Welcome to CareHero Podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Welcome back, Care Heroes. Thanks for popping by for another episode of Care Hero Podcast. I'm your host, Gerard Hernandez.
And I'm Martin Hoy. We're very excited to introduce you all to our special guest for today's Care Hero Podcast episode.
Yes, today we have Dr. Lindsey Harris, an inpatient glycemic management nurse practitioner, joining us from the Magic City, Birmingham, Alabama.
That's right. She's also a vibrant and passionate healthcare professional and a very active leader in her community.
And Dr. Harris has such an inspiring story and excellent tips to share, including the importance of listening to your heart and finding your calling, to not be afraid of big challenges, the significance of networking and putting yourself out there, also to remember the power of kindness and treating others with respect.
Oh man, that sounds awesome, Gerard. Let's go.
Lindsey, welcome to the show.
Thank you for having me.
And so, Lindsey, we always start off with our show with this question. All of our care heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
One superpower. That is a very good question. If I had to choose one superpower, my superpower would be, and it's probably the obvious, me being a healthcare worker, is to heal. I would love to be able to heal anyone that I touched, anyone that I looked at, even those who don't even know that they're sick. I want to be able to heal them because I feel like if we have a healthy nation, everyone will be happy and it would just be great.
That's a good one. I mean, it's very relevant for you as a healthcare professional. Actually, and frankly, you have the power to heal. You've been healing people for your entire career.
That is right. That honestly is one of the reasons why I went into nursing, is because nursing is such a holistic profession and we heal people holistically, mentally, physically. That's one reason why I love it so much.
You're very passionate and you're a very skilled healthcare professional, over a decade of experience. Talking about that background, could you tell us about your story, your background, and how did you get into healthcare?
When I actually was a young girl, and I could say probably 4 or 5, I can remember asking my parents, watching people that are less fortunate on TV, or even seeing people as we pass down the road, asking them, can we help them? Can we bring them something? Can we give them food? Can we give them clothing? And so I've always had a passion for helping. And what better field other than nursing? Nursing over the past 18 years, I believe, according to the Gallup poll, has been the most trusted profession. For me, I started out doing that through high school. I did lots of community service projects. Health has just been something that's very near and dear to me. And I went to school and just decided on nursing as far as college and community service. I continued doing community service. It is a part of my life. And to be honest, I feel like that's why God has put me on this earth.
Absolutely. That's exactly what I was thinking. You were born into this profession, essentially, starting at 4 or 5, just thinking about helping others, developing your superpowers at a young age.
That's right.
And Lindsey, currently you're an inpatient glycemic management nurse practitioner at the University of Alabama at Birmingham School of Nursing. Could you tell us a little bit about your role and what you do there?
On the inpatient glycemic team, there are 5 nurse practitioners. UAB has about 2,000 beds. So we manage patients with diabetes or with hyperglycemia, high blood sugar. So needless to say, we're pretty busy, as you know, with the statistics in Alabama as far as the diabetes rate as well as hypertension rates. Our goal is to maintain their blood sugars during their hospital stay. It is very rewarding because I also have the opportunity to educate the patients why they are there, encouraging them to continue to manage their blood sugars and keep them under control. So it is a very rewarding job. We're actually a consulting service. So we see anywhere from, we go to psychiatric patients, we see rehab patients, any specialty at the hospital. So I've been doing this, I think it was 2014 when I began.
It's great that you can spend all that time in one specialty and really get the expertise you need to be an expert.
Yes. I mean, I'm a family nurse practitioner. The ability to treat patients holistically is definitely a passion of mine.
Lindsey, what does a typical day look like for you?
We are, as I mentioned, a consulting service. So we have 25 to 30 consults a day, and we will divide them up between the five of us. And we see about anywhere from 15 to 25 patients per day because we also have follow-up patients. In the midst of this, being in many nursing organizations and trying to manage and maneuver through COVID, as we all are, trying to figure out ways how we can best support the nurses. While we're taking care of patients, we have to remember we must take care of ourselves as well.
What do you love most about your role?
First of all, I love the connection that I have with my teammates. So we are very close. We have one office. We're very close. It's like a family. So I love that. I enjoy coming to work every single day. The nature of being a provider, the nature of being a nurse, being at the bedside with patients and helping them through those difficult times. I truly enjoy just connecting with patients, connecting with their families. Nursing is definitely a calling.
You're seeing, you said, up to 25, maybe even 30 with consults, right? 30 patients a day. What's the biggest challenges you have as a nurse practitioner dealing with this?
Well, one of the biggest challenges is managing the patients with diabetes and having other comorbidities. As I mentioned, diabetes, hypertension, then you also have kidney disease, liver disease, and things of that nature. So managing blood sugars with those comorbidities really makes it difficult because everything inside our body, it works together. And so when one thing is malfunctioning, it could affect other things. You have to really think about this patient does have renal failure, which means that the blood sugar or the insulin that they receive is going to remain in their body a lot longer. You have to change the way you think and give the person maybe less insulin so that their blood sugars don't drop too low. So, I mean, there's lots of things that you have to think of. So imagine doing that and having 15, 20 patients, and you have to think of that. So it becomes very challenging, but it becomes very rewarding as well.
And Lindsey, how do you continue to learn in order to stay on top of things within your role?
As a provider, we have to maintain a certain amount of continuing education courses. So that's one thing that we do. We have classes while at work. We read articles amongst each other and share the new advances and things of that nature. So the University of Alabama at Birmingham, they are really cutting edge, especially in the South. So consistently doing different studies and learning new things about diabetes and how it works in curing diabetes. So it really allows us to really stay abreast of the new advances and be on the forefront of healthcare.
Could you suggest any strategies that you've learned that our CareHero listeners who don't work in university-affiliated hospitals could do?
Seek information. There are many conferences that are specific to your specialty. And that's one of the things that we do as well. We go to conferences. There's a diabetes journal. We subscribe to the diabetes journal, which has all the new advances, treatment for diabetes and cures for diabetes. Doing those things, seeking those who also are experts in your field, maintaining a relationship and a collaboration with maybe physicians, with maybe other nurse practitioners or other nurses. I believe that in itself will help you to stay abreast and to advance your practice.
What other factors help to get you to where you are today?
Of course, I'm going to give honor to God, I think, with his guidance. And without him, I wouldn't be here. I would also say my parents, of course, David and Carla Harris. They're amazing. Just the opportunities that they've afforded me to be where I am today. I'm very blessed. But one of the things after I began college, I immediately joined as a student the professional organization. Professional organizations have been so pivotal as far as having mentors within the organization and just learning different aspects of professional nursing. And that really, truly is important.
We also want to congratulate you on making history for becoming the first African American president of the Alabama State Nurses Association. How did you come into that position at only 37 years young, and what does it mean to you personally?
Thank you. I really appreciate that. I started out as a student in the Birmingham Black Nurses Association as a student representative. So I took office immediately. I became the student rep. Then I became the secretary, and its history after that. I became the president of the Birmingham Black Nurses Association. So being in that organization, going to national conferences, meeting leaders in the nursing sector really helped to groom me and mentor me. It just really helped me and taught me what true leadership is, how to manage. It brought me to where I am today, and I'm very grateful.
I think this is such a powerful story for our CareHero listeners to take from joining the professional organization, even though you're a student, taking that opportunity, like where it has led you, meeting other people in the profession to guide and mentor you, and now being the president. That's just so wonderful to hear and so inspiring.
Even after or while I was the president or while I was in the Birmingham Black Nurses Association, affiliate of the National Black Nurses Association, I became a member of the Alabama State Nurses Association. And there I held many offices, the secretary, the president-elect, and was just encouraged by those members as well in that organization to think about running for president. I thought, me, no way. Like, I don't think I could do that. Over all 100,000 plus nurses in the state of Alabama, I decided to do it because I really felt that I was ready. I felt like that I had been groomed and mentored by many people that have come before me. So I did it and I won, and I'm very thankful for it.
That's great. And I want to really pick up on that mentorship piece where going to all these different conferences allowed you to meet different people and get mentors all over the US. I think that's something that especially Black, Indigenous, and people of color lack in a lot of their natural work environments. We need to really step up and seek out those opportunities because they don't always come to us.
You're exactly right. One of the things, especially amongst African Americans, I believe in nursing, there are only about 279,000 Black nurses in the United States. And there are over 3 million nurses. That is a very small percentage. That's one of the issues that we face today. But we are going into schools at a very young age to encourage young people to become nurses and become healthcare providers. We must seek mentors. They don't necessarily have to look like you, but I do feel a different connection when I see someone that looks like me. And that's one of the reasons why it makes it so special for me to be the first person of color. Because that gives young people opportunities to say, wow, she's a woman and she's the president of the Nurses Association. She's a Black woman. I know, and I've heard it from people that I know it's very inspiring. So that is what's special for me personally.
You can't be what you can't see. Someone like you that has made it to the upper echelons of the organization, I think, is really special, especially for a lot of those folks in Alabama that are looking up to you as a mentor and as a role model.
Yes, that's right.
You talked about people saying that you should think about running for president. I think also a lot of folks, whether you're running for president of a state association or you're looking at potentially going for that next degree or going for that next role or switching roles, there's always that question, can I do it? Should I do it? I want to just kind of dig into that a little bit. Who are the types of people that were telling you that you could do it and that you should do it?
Absolutely. Being in the Alabama State Nurses Association, so we have conventions every year around September and October. Just going there every single year, meeting people around the state of Alabama. I call it networking, but talking and getting to know them throughout the state, building those relationships and allowing people to really get to know you, truly help them to know who Lindsey truly is. Seeing me in leadership positions. So I was the secretary of the state organization. They saw me on our board meetings. They saw me at our conventions. That was something that really helped people to recognize that she is a leader. She is responsible. and that she can do it. So networking is one thing that is really important. Being able to speak to people from all over and really connect with people. And that's one thing I find that nurses really do. We connect very well with people.
Empathy is definitely part of the job description.
Yes, absolutely.
You're such an active member and leader in your community, Lindsey. Could you tell us a little bit about your volunteer experiences and what inspires you to give back to the community?
Yes, as a member and officer in the Birmingham Black Nurses Association, that's one of the things that we really hone in on, or really that's one of our main focus is service as well as scholarship. As I mentioned, I feel like nursing is truly a calling for me. And that is one thing that I know, or one reason why I know I am living my purpose in the community. When churches are having healthcare summits and we're able to take blood pressures and we're able to educate the community on different healthcare topics, it really does something to me. It gives me a sense of satisfaction and a sense of fulfillment. And that's one of the reasons why community service and giving back means so much to me, because selfishly, I gain so much from it.
Yeah, it's great that you have that. You found something that you do, that you love, that you can get paid for. And that's something that not everyone has. You're in the minority, possibly. I love that, talking to you and others like you that have found that purpose in healthcare. It's truly inspiring.
What's the most inspiring or touching moment you've had in your career?
I would say, honestly, is becoming the first person of color in 107 years of the Alabama State Nurses Association. I mean, it's a step, and it's a step in the right direction, and it couldn't have come at such a better time. Now, I was elected 2 years prior. I was going to be the president during that time, but even becoming the president during all the social injustice and the social unrest, it was really special because it felt like, for people of color, some sort of win, some sort of a sigh of relief. So it was very special for me.
So Lindsey, you were elected 2 years prior, as you said, and you were just inducted last September 2020. And this is a fully volunteer position. You have a full-time job in addition to your role at the association. Could you tell us a little bit about your plans for the association, what you think you might be able to accomplish in the next few years?
The Alabama State Nurses Association, as I mentioned several times, is the voice for all of nursing, 100,000 plus nursing. So our goal is to hear the nurses, listen to what they need. Our goal is to help produce that. One of the things that we've done already, especially during the pandemic thus far, is we've completed 2 surveys to address the issues and the needs for the nurses. Another thing that, I mentioned this earlier, mentorship. We did not have a formal mentorship program. And we've noticed that a lot of the new graduates up to about 3 years really need that mentor, really need that connection. So we're in the process of creating a mentorship program for that nursing population. And then one of the other things that we're doing most recently is a peer-to-peer support. So we recognize that, and it's going to be a statewide peer-to-peer support. So we recognize that nurses are really having a hard time during COVID. So why not develop a peer-to-peer support, allowing the nurses to have access to a counselor on the call as well as a chaplain, and just kind of talk about, what they're going through and talk about any questions that they may have and hear from other nurses around the state of Alabama.
That mentorship program and those peer support programs you're establishing are extraordinarily important, especially now. I mean, with the new grads entering the workforce during a pandemic, an unprecedented time. I mean, this is exactly what they need. Kudos to you.
Thank you. Thank you very much.
What's the best piece of advice you've ever been given?
I would say probably do unto others as you would have them do unto you. That is, treat people all the same, treat people kindly. And for me, that really resonates me. And I take that everywhere. I see no color when I'm talking to people or when I'm looking at people. That really, truly will help you go a long way.
And Lindsey, in your experience, what's the best way to work and communicate with management?
definitely be prepared. So when you're going in to talk to you're a manager or administrator, be knowledgeable about the topic that you are speaking about and really just be yourself.
Being prepared is something we hear from a lot. I think it's important that you go to management with often solutions to your problems. I think that's exactly what you're saying, which is I think it was super important.
Lindsey, you've had such a fantastic career and you still have a long way to go, of course. But so far, what's the best compliment you've received?
I would say, only because this makes me, I feel like it's truly a part of my being, is that I'm a great connector. And when I say that, I am one, as I mentioned, I don't look at race. I don't look at gender. I don't look at age. I really don't look at anything. So being able to connect people and bring people together, really, I hear that a lot. And I'm very proud of that. Even bringing organizations together. Currently, the Alabama State Nurses Association, we are writing a grant, and the grant is presented by the Alabama Department of Health. And their goal is to decrease the disparities for vaccinations and decrease the hesitancy or educate the communities of color about the COVID-19 vaccine. So what we have done is we've brought the Filipino Nurses Association, the Hispanic Nurses Association, the Black Nurses Association, along with the Alabama State Nurses Association, and different other pastors and priests and bishops together as one collective voice in order to address this challenge.
This compliment of being such a great connector, in this conversation, we could really see that. And it's no surprise that you are heading the charge and being such a terrific leader over the 100,000 nurses in Alabama.
Thank you.
So, Lindsey, if you could do anything to improve healthcare in America, what would you do?
I think that having the opportunity, first of all, is important. So we have so many, especially here in Alabama, so many areas to where they don't have the access to healthcare as many of us do. If you don't have it, you find other things. You don't go to the doctor. I mean, some people have to drive 30 and 40 and 50 miles just to go to a primary or even a hospital. So having access to healthcare, if I could do anything, I would improve access to healthcare for America.
So important, especially now, especially during the vaccination process, trust in our hospital system and our medical system is so important. And access is such a big issue in a lot of places in this country.
I know in your day-to-day work, you see a lot of patients with so much comorbidities. How do you stay healthy, or what do you recommend now? Or how do you personally stay mentally and physically healthy during this pandemic?
When I was at Stanford University, I actually played basketball. And so I have always enjoyed working out. I've always enjoyed just staying fit. So going to the gym is very important to me. I truly love it. And, as far as mentally, I just disconnect. And I have to turn off phones and turn off computers and really just focus and, in a sense, just meditate and let my mind and my body rest. I think those are important. And one other thing that is very important for health is to get the proper sleep. Oftentimes we're running on fumes. Getting the proper sleep is very important.
Yeah, full regimen, taking care of mentally and physically, exercise, it has to be tackled in multiple facets. And that's great to recommend that to our listeners, and good reminder of them that even at the top in your career, you still got to take care of yourself.
You can't take care of your patients if you can't take care of yourself. Just like in the airline, you have to put on your oxygen mask before you can help others. It's the same thing. As a healer, you need to make sure that you keep yourself in good condition in order to be able to do your job.
That's exactly right.
Say you get to travel to the future. What does the future of nursing look like in your field?
I think nursing continues to be that most trusted profession 50, 60, 100 years from now. Nursing, we are there through the lifespan. So we're there from birth all the way to death. Nurses treat patients holistically. So we will continue to be that connection away from our family members. We will continue to be that caring voice, that loving touch. Nursing really is an art. And I would love for nursing in the future to continue and remain to be that art, that holistic profession.
As an attorney and by training, it's really interesting because we are ranked as some of the least trusted people, talking to you and talking to other nurses like you. And it makes a lot of sense that nursing is a very trusted profession.
Yes.
Just a follow-up to that question, what does the future of nursing look like for the state of Alabama nurses?
Essentially, I would say the same thing. One of the things that we'd like to see in nursing within the state of Alabama is, in which I know this is everywhere, especially now during the pandemic, but we have shortages of nursing. So one of the things that the Alabama State Nurses Association has done to address this issue is we have a program called Hot Jobs, as to where we help hospitals within the state to find that perfect match for the position that they are looking to fill. I would love for us to help and bring that to fruition, or help to alleviate issues as far as the shortage of nursing. We want to focus on the nurses focusing on themselves, exactly what we spoke about earlier, mentally, physically. So I'd love to see nurses having that sense of self-care and to maintain that sense of wellness and healthiness amongst themselves.
Wow, that's fantastic. And just like the rest of our conversation here, it has been absolutely wonderful, Lindsey. Do you have any final thoughts or advice for our care heroes?
Continue to be a hero. Everyone is a hero in their own way. And to the care heroes, to those who are listening, I would say that no matter what profession you're in, you can be a hero. One of my mottos, as I said earlier, is do unto others as you would have them to do unto you. And then be kind. I know that Ellen DeGeneres, I don't know if you all watch that show, but I know that that's one of her mottos, is to be kind. And I really like that, because you just never know what people are going through and what situations they're in.
Wow, what a fantastic episode with Dr. Lindsey Harris. I feel honored that you took the time to join us on CareHero Podcast.
I concur, Martin. It's always so great to hear such inspiring stories from care heroes from all over the country. Now it's time for the handover.
All right, Care Heroes, here are our top takeaways from this episode. Listen to your heart and find your calling. Find a career path that speaks to you so that you can have a job that you love showing up to every single day. Don't shy away from big challenges. They're the ones with the biggest rewards. Don't be afraid to network. Join professional organizations and seek mentorship. With the help of others, you can significantly expand your knowledge and evolve in your career. And last but not least, remember to be kind and do unto others as you would have them do unto you. Regardless of age, gender, skin color, or status, we are all human beings at the end of the day, and we are all deserving of kindness and respect.
Nice handover, Martin. We also want to thank you, our care heroes, for listening. And don't forget to rate our podcast on your favorite podcast app. If you want to shout out on a future episode, just visit careheropodcast.com, go to the Contact Us page and submit your name, role, and location for a shout out on a future episode.
That's right, Gerard. Now it's time for some shout-outs. We want to give a shout-out to Chelsea, licensed practical nurse from Minneapolis, Minnesota, Al Marie, registered nurse from New York, New York, and Arjun, physician from San Francisco, California.
Okay, care heroes, that's it for now. Thanks for joining us on the show. We'll be back for the next one. Same Care Hero time, same Care Hero channel.
Thanks for listening to CareHero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a care hero to be interviewed on a future episode.